Good day. This is Joel Brill, and on behalf of the American College of Gastroenterology, the American Gastroenterological Association, and the American Society for Gastrointestinal Endoscopy, welcome to Understanding the RUC Survey process. Over the next few moments' time, we will go through Understanding the RUC Survey, and we'll cover survey basics, the purpose of the RUC Survey, who does what. We'll provide you with some information on breaking down the survey into 7 easy steps and what happens next, as well as provide you with an opportunity to submit your questions. So again, thank you in advance for agreeing to participate in the upcoming RUC Survey. The GI societies need your help to assure that relative values will be accurately and fairly presented to the Centers for Medicare and Medicaid Services during this revision process. This is important to you and other physicians because these values determine the rate at which Medicare and many other payers reimburse for procedures. For this series of codes, the responses will be due by July the 9th. The survey will close at midnight Pacific time. There will be no exceptions. You will not be able to submit the survey responses after that deadline because the data must be analyzed before the GI societies can submit it to the RUC along with their recommendations. So the purpose of the survey is to obtain estimates of the time and complexity required in performing a procedure and to obtain an estimate of a recommended work relative value unit, or an RVU. The survey asks you to compare the time, the complexity, and the physician work of the surveyed procedures to an existing procedure, and a list of potential reference procedures is provided for comparison purposes. Now, the ACG, AGA, and ASGE are conducting RUC surveys in the following codes. Flexible sigmoidoscopy, there are 11 existing and 2 new codes. Ileoscopy, 2 existing and 2 new codes. And for pouchoscopy, 2 existing codes. Based on the data from the surveys, the Society will then recommend a work value, or an RVU, back to the RUC. So what codes are being surveyed? Well, the existing flexible sigmoidoscopy codes in the series of 45330 through 45342. There are 2 new codes, 4534X1 for flexible sigmoidoscopy with ablation, and 4534X2 for a flexible sigmoidoscopy and stent placement, which includes pre- and post-dilation and guide wire passage. The existing ileoscopy codes 44380 through 44382 will be surveyed, and in addition, 2 new ileoscopy codes, 4438X1, ileoscopy with balloon dilation, and 4438X4, ileoscopy with stent placement. And the existing pouchoscopy codes 44385 and 44386 will be surveyed. So who does what? Well, the AMA Specialty Society RVS Update Committee, or the RUC, oversees the survey process, and they recommend work RVUs and practice expense inputs to Medicare. The specialty societies coordinate the process for the respective professions. We distribute the work surveys to members in order to obtain physician work and practice expense data, and we submit the survey results to the AMA RUC. The specialty societies will submit recommendations to the RUC for physician work, practice expense, and professional liability insurance crosswalks. The recommendations are presented to the RUC meetings, which occur 3 times a year. The RUC sends its recommendations for work RVUs, practice expense inputs, and professional liability insurance crosswalks to Medicare in May. These recommendations remain confidential until Medicare publishes the final rule in November. The values will go into effect then in January of the following calendar year. So what are the 7 easy steps? Step 1 is to review the code descriptor and the vignette. That is a short descriptor of the typical patient. Step 2, to review the introduction and to complete your contact information. Step 3, identify a reference procedure. Step 4, estimate your time. Step 5, compare the survey procedure to a reference procedure. Step 6 addresses a question about moderate sedation. And in Step 7, you will estimate your work RVU. So let's go to Step 1. The vignette describes a typical clinical scenario for the procedure. You may have performed the procedure on a patient different than the typical one described in the vignette, and that's okay. You can still use your experience to guide your responses. So we will ask you to complete the survey instrument using the typical patient described in the vignette. The survey instrument does allow you to indicate if you do not believe that the vignette provided describes your typical patient. And in that case, you will be prompted to provide a description of your typical patient. In step 2, we will ask you to review the introduction and complete your contact information. Although the contact and basic practice information is collected, please be assured that your name is never forwarded to the AMA or used for tracking purposes. Please note that the survey is to be completed independently without coaching or assistance, with the exception of clarification from specialty society staff at the ASGE, AGA, and/or ACG. If you are inappropriately contacted regarding the survey, it is important that you immediately notify specialty society staff. For any questions about the survey, society staff are Leslie Narramore, lnarramore@gastro.org, Sam Reynolds at ASGE, S. Reynolds at asge.org, and Brad Conway at the ACG, bconway@gi.org. In step 3, we will ask you to identify a reference procedure. Now, you will be provided with a list of reference service procedures, and we will ask you to select a procedure from the list that is most similar in time and work to the new or revised CPT code descriptor and the typical patient and service described. The reference procedure you select does not have to be equal in work in your judgment to the surveyed procedure, but it should be similar in work. In step 4, we will ask you to estimate your time. Using the vignette for the surveyed service, please estimate how much time to the minute it takes you to perform the procedure for the typical patient. Now, we note that while certain patients may require additional time and effort, the survey is intended to estimate the work for the typical patient. Thus, your estimate should be based on your personal experience and the typical patient. In the pre-service period, this includes physician services provided from the day before the procedure or service until the time of the procedure or service. Please note that the administration of moderate sedation is included in the pre-service period. Thus, the pre-service period includes an assessment of the patient's status for indications, contraindications, and fitness to undergo the endoscopic procedure. This may include procedural workup, a review of the records, communicating with other professionals, patient, and family, coordinating scheduling and preparation, and obtaining consent, dressing, scrubbing, and waiting before the operative procedure, preparing the patient and needed equipment for the operative procedure, positioning the patient, and other non-first scope in to last scope out work in the OR is also included in the pre-service period. The pre-service period includes your assessment of the patient's fitness for administration of moderate sedation if it is personally administered or supervised by the endoscopist, and all time for the administration of moderate sedation, from the first dose administered until the endoscopic procedure begins, if personally administered or supervised by the endoscopist, including management of sedation. Well, what does the pre-service period not include? It does not include consultation or evaluation at which the decision to provide the procedure was made. It does not include distinct evaluation and management services provided in addition to the procedure. It does not include mandated services, and it does not include staff time, such as for scheduling the procedure or providing instructions. The intra-service time includes all physician first scope in to last scope out work that is a necessary part of the procedure. And the post-service period includes the physician services provided on the day of the procedure after the procedure has been performed. So the post-service period includes that non-first scope in to last scope out work in the operative room, where there is patient stabilization in the recovery room or special unit, communicating with the patient and other professionals, which may include written and telephone reports and orders, and patient visits on the day of the operative procedure. It includes an assessment for fitness to discharge from the procedure area when performed by the physician, and it includes discharge instructions and counseling to the patient and caregivers when performed by the physician. The post-service period does not include unrelated evaluation and management services provided during the post-operative period. It does not include a return to the operating room for a related procedure during the post-operative period, or an unrelated procedure or service performed by the same physician during the post-operative period. Calling the patient and communicating lab results is not part of the post-service period. In Step 5, we will ask you to compare the complexity or intensity of the surveyed service with the reference service that you have selected, and please do so in terms of the following 4 components: the time, mental effort and judgment, technical skill and physical effort, and psychological stress. Physician work does not include services provided by support staff who are employed by your practice and cannot bill separately. And that might include registered nurses and licensed practical nurses, medical secretaries, receptionists, technicians, and assistants. In Step 6, we ask you to address moderate sedation. Moderate sedation is a service provided by the operating physician or under the direct supervision of the physician performing the procedure to allow for the sedation of the patient with or without analgesia. For the purposes of the RUC survey, sedation and analgesia delivered separately by an anesthesiologist not performing the primary procedure is not considered moderate sedation. In Step 7, this is the important step, estimating the work RVU. In this final step, you will be asked to estimate the work relative value unit. You will be asked to consider the value assigned to the reference procedure in developing your estimate, and thus the survey methodology attempts to set the work RVU of the procedure relative to the work RVU of the comparable and established reference procedure. So how are the surveys being conducted? Well, they're being conducted online. Please look for an email in your inbox from gastro.org at softekdc.com. And the subject line will say GI Survey for CPT codes XXXXX. So please don't forget to check your spam folder. Note that the link is specifically for you. If you have a colleague who is interested in completing the survey, please ask them to email their information to surveys@asge.org. So again, the next steps, you will receive an email message from gastro.org at softekdc.com. This email will contain a link to the survey platform, and it has your personal login information. When you log in, you will have immediate access to all of your surveys. Please submit your completed surveys by July the 9th at midnight Pacific time. If you still have any questions, don't hesitate to contact staff from any of the societies. At the AGA, Leslie Narramore, 410-349-7455, L. Narramore at gastro.org. At ASGE, Sam Reynolds, 630-570-5643, S. Reynolds at asge.org. And at the ACG, Brad Conway, 301-263-9029, B. Conway at gi.org. Again, thank you for your participation in the RUC survey process. Have a great day.